This is my opportunity not only to introduce my friend, Dr. Judith Joseph, but also to brag on her a little bit because she is a bona fide overachiever. And I mean that in all the best ways. Dr. Judith Joseph is a board-certified psychiatrist, an assistant professor in child and adolescent psychiatry at NYU, and chair of the Women in Medicine Board at Columbia University's College of Physicians and Surgeons. Her passionate advocacy for mental health awareness and pioneering research on high-functioning depression makes Dr. Judith Joseph a leading voice in modern psychiatry. She is the author of the best-selling book, High Functioning: Overcome Your Hidden Depression and Reclaim Your Joy. She's going to help us unpack the hidden struggles behind high achievement, the science of emotional wellness, and how we can better care for our own mental health. This episode was brought to you by Alloy Health and Rivian. Dr. Judith, welcome to The Second Opinion.
Thank you for having me, Dr. Malone. It's a pleasure to be here.
Oh, I can't wait to get into this conversation. Now, I must admit, until I read your book, I had never heard the term high-functioning depression. But once I heard it, I almost intuitively understood what it meant because at one point or the other, I'm sure I've had it. So to get started, Dr. Judith, can you explain for our audience what exactly is high-functioning depression?
Well, I'm not surprised that a lot of people haven't heard about it because in our healthcare system, it's more culturally and socially acceptable to say, I'm burnt out, right? If you go to a party and you say, I'm burnt out, people will say, me too. Yeah, me three. But if you walk into a party and you say, I'm depressed, like it's crickets. People get awkward. They kind of like want to move away from you. So the term burnout, I think, is overutilized, especially amongst healthcare professionals. And when you think about it, burnout is a fairly new phenomenon. It was not in our medical coding system until about 30, 40 years ago. But no one would argue that it didn't exist before that. It just wasn't in the textbooks. Burnout is a workplace phenomenon. So if you're in a workplace setting, you have these symptoms of burnout like fatigue, low motivation, irritability. But when you leave the workplace setting, you should get better because it's the setting creating the symptoms. High-functioning depression is different, and here's why. It's really important. When you are in your work setting, you have these symptoms of depression, but even when you remove these high-functioning folks from the workplace, they still don't get better. They still can't sit still. When they're not busy, they feel empty. When they're not working, they feel restless. They're the ones that on the weekends, they're cleaning out the garage. They're taking on their kids' projects. They have 2 or 3 side hustles. They cannot sit still. There is something within them, this unprocessed trauma and pain that leads them to avoid dealing with it by being busy. So think burnout, the workplace, the setting is causing the symptoms. High functioning depression, it's something within the individual that's causing the symptoms. That means that even in other settings, they still can't sit still and relax.
And I think that what we think of when we think of depression is people who have sort of diminished function. They're lying in bed or not eating or, really just sort of, we think of depression and we think of inactivity and really not functioning very well. But when people are really getting everything done and keeping all those plates spinning, they don't even realize that they're depressed because they don't give themselves at least the moment to think about it. And I think that they're too busy trying to keep those plates from crashing on the ground to think about how they feel internally. And one of the things I really want you to talk about is really who is most vulnerable to high-functioning depression.
Yes, exactly. When you look at the checkbox of the symptoms of depression for clinical depression, let's say the depression most people know about, right? The staying in bed, crying, looking sad, not getting things done. You go through these symptoms. So low concentration, low appetite, or changes in appetite, changes in sleep, changes in energy, low mood, or something called anhedonia, which is a lack of joy and pleasure in things that used to really light you up. Then you get to the very bottom of the list. And if you don't check that box at the bottom that says you're somehow impaired in your functioning or you're in distress, your healthcare provider will say, come back when you break down, right? And I know you are one of the leading experts in menopause. It's the equivalent of saying, let's wait for your bones to break before we treat the osteoporosis, or let's wait for the cancer to get to stage 4, and then we'll react. In mental health, we are still in the dark ages. We are still waiting for you to check that bottom box of I'm not functioning or I'm in distress to do something about it. And I wanted people to change their methods of approaching this because we are in the thick of a mental health crisis. If we wait for people to break down, we are going to be in a worsened crisis than ever before, given what we've seen in the trends and data over the past 5 years. So I want you to recognize who's at risk. These are people who can't slow down. I conducted the first study in high functioning depression that was ever published by a peer-reviewed journal. And what we found in that data was that high functioning depression is highly correlated with trauma. So think, you're trying to avoid the trauma by staying busy, and caregivers were at higher risk for anhedonia, that lack of joy, than other participants in the study. So think about that mom who can't slow down. She has kids that depend on her, and she has a career that depends on her. Think about that healthcare professional who has been ingrained in their culture to think about patients and think about the hospital and put themselves to the side. Think about entrepreneurs who they don't want to ever become bankrupt, so they don't take care of themselves. They're so busy taking care of everyone else. And think about that immigrant who came to this country like myself, who had very little, and started off with scarcity trauma and has this unresolved fear of running out of resources. So they continue to work themselves to the bone. These are people who are at risk, but these are also the people who will not get support because they appear high functioning on the outside. They wear a mask of pathological productivity and they cannot slow down, and they don't know why they can't slow down.
You know, one of the very interesting things that I got from your book is not just how the biopsychosocial model affects our physical being, but it also affects our mental well-being. Can you just explain to our listeners, like, what exactly is the biopsychosocial model so they know what to look for and who may be vulnerable?
And the biopsychosocial model is something all medical students learn. So I wanted to democratize this information because I truly believe it's a powerful model to help each and every patient understand the science of their own happiness. And here's why. If you imagine that joy is built within our DNA and we are encoded to have joy, it's our birthright as human beings. Why is it that so many of us can't grasp it? Well, we don't understand what makes us unique. You know, there's only one you, Dr. Malone. There's only one me who will ever exist in the history of the universe and the future of the universe. So we have to understand what makes us unique. And when I think of the biopsychosocial, I think about fingerprints, how we all have a unique fingerprint. And we all have a unique biopsychosocial as human beings, right? Every human has a biopsychosocial, but all biopsychosocials are unique, like a fingerprint. Biologically, what's happening in terms of your physical makeup? Is it that you have a medical condition? Some of us have high blood pressure. Some of us have asthma, diabetes, metabolic conditions. Myself, I have low thyroid. So I have to think about how biologically I may be at risk for losing my points of joy, because a thyroid condition makes you at risk for anxiety and depression and a whole host of other issues if it's not taken care of. Also, biologically, what are you at risk for in terms of your family history? We know that mental health issues run in families. So you want to think about ways to reduce your risk factors. Psychologically, what are your traumas? I already talked about my personal scarcity trauma, but other people have different types of traumas, right? Some may have been in emotionally unhealthy relationships in the past with a family member or a partner. Others may have attachment traumas because of how they were raised. Maybe they were neglected or abused. Understand that and unpack it. And then psychologically, some of us have other conditions like ADHD or PTSD or other conditions that may detract from our points of joy. Socially, when you look at the biopsychosocial, socially, what's happening in your environment? For me, I live in a city, so I don't have that much access to nature. But for others, it could be other social factors like, what are you eating? Is it processed? Is it causing inflammation? Are you moving? Are you getting rest? Are you engaging in behaviors like excessive alcohol use or substance use? Are you around healthy people or not? Those are the social environmental issues that could be draining your points of joy. So when I do these speaking engagements, I will literally have people draw their biopsychosocial out, and they'll see that no two biopsychosocials are identical. So when you understand where you're losing your points of joy, then you know how to focus and to add back in those areas. And you also know where to prioritize.
One of my favorite memories was a double mother-daughter trip to Paris in the springtime. It was my daughter's first trip to Paris, and I went with a close friend and her daughter. Instead of getting hotel rooms, we decided to book a cozy home on Airbnb. We were centrally located, could easily sightsee, get fresh groceries, and some good wine, of course. It was our home away from home and one of my favorite trips I've taken with my daughter. As I look around at my family, I feel so grateful for the opportunity to make new memories. I often think, while we're away making these memories, someone else could be creating their own special family traditions in my home. That's what I love about hosting on Airbnb. Your home doesn't have to sit empty. It becomes a place for another family to gather, cook, and make memories of their own. By opening up your extra space, you could turn it into a welcoming retreat for travelers from around the world. And the added income? It could help fund future adventures, thoughtful gifts, or whatever else matters most to you. Wouldn't it feel good to know your home has its own holiday story to tell? Your home might be worth more than you think. Find out how much at airbnb.com/host. This episode is brought to you by our friends at Rivian and their all-electric, full-size SUVs and trucks made for all of life's adventures. Rivian just announced their all-new Rivian Quad, their fastest, most capable vehicle yet. Powered by 4 motors, one for each wheel, it gives you unmatched traction, control, and performance anywhere you are. On winding roads or off-road trails, the Quad is engineered for precision driving and maximum adventure. With a native NACS port, the Quad is compatible with 50,000 DC fast chargers, so getting back on the road is hassle-free. With beautifully designed interiors, tons of storage, and incredible capability inside and out, the Quad is made for everyday comfort and rugged utility. Plus, you'll love the tech. The Rivian experience gets better over time with software updates. The premium audio experience sounds as good as the ride feels. Premium audio is part of the Sound Plus Vision package in quad and tri vehicles and can be a paid upgrade in dual models. And the Rivian Autonomy Platform Plus, a paid subscription product, offers a full suite of advanced safety and driver assistance features. There is adaptive cruise control, active lane keeping, blind spot monitoring, and forward collision warning with automatic emergency braking. Check out the all-new, all-electric quad truck or SUV and the full lineup of vehicles now at Rivian.com. This episode of The Second Opinion with Dr. Sharon is brought to you by Alloy Health. My favorite saying is, there are no accidents in the universe. 5 years ago, my friend Michelle Obama invited me on her podcast to discuss menopause. So this is a full circle moment. She very honestly discussed her menopausal symptoms and what she chose to do about them. Michelle Obama was one of the first famous people to admit that, yes, I had debilitating hot flashes and drenching sweats, and I did something about it. What she didn't do was suffer through it. By normalizing this conversation, she took the shame and stigma out of menopause. Believe it or not, that exact conversation was the catalyst that led me to becoming the chief medical advisor at Alloy Health. The founders of Alloy Health, Ann Fullenwater and Monica Mollenauer, heard that conversation and tracked me down, and I am glad they did. After nearly 30 years of private practice, Alloy Health has allowed me to leverage my expertise, not just to my patients one-on-one, but has given me the opportunity to bring this information to women everywhere. My whole career has been about helping women feel empowered to advocate for their health. And Alloy was created with this specifically in mind. Join the 95% of women who tried Alloy and saw relief in the first 2 weeks. Head to myalloy.com and tell them all about your symptoms, and you'll get a fully customized treatment plan. And you'll get $25 off your first order today when you use code TSO25. Head to myalloy.com and enter code TSO25 to get $25 off your first order. You know what is funny is that since I read your book, and I have been asking friends questions like, what brings you joy? And it's surprising to me how many people don't really connect or remember what really brings them joy. You know, we do things, we're busy all the time, but to say, give me the top 2 things that really bring you joy. And isn't that amazing that we've come so far from it that we don't even remember what it is? We know what is supposed to bring you joy, but does it really?
Yeah, people get the two confused. They will get confused the term happy with joy. And in my lab, I have a research lab, and then I have a private practice. And in the private practice, my therapy patients come in all the time. And the first thing they ask is, Dr. Judith, I just want to be happy. What do I have to do? And then I ask them, well, what does happiness mean to you? And usually what they'll say is, I'll be happy when I get a career that I'm proud of, or when I pay off my debt, or when I get that perfect partner, the love of my life, or the perfect family. It's always some event or an idea. But the research shows us that when you get those things that you're delaying happiness for, you are still unhappy. You still keep searching. So think you are still unhappy. You still keep searching. So think happiness is an idea and joy is an experience. Because in the research practice, Dr. Malone, when we add up and we determine whether or not you're getting happier or not, we're adding up points of joy. We're adding up things like, when you ate, did you really savor it? Was it yummy? Were you like, that's a point. If you were tired and you took a rest, did you feel refreshed when you woke up? That's a point. When you were lonely and you reached out to a loved one, did you feel connected and seen? That's a point. When you were stressed, were you able to self-soothe and calm those nerves? That's a point. So you add up these points of these plethora of human sensations. And that experience of joy points, that's what happiness is in research. But there's a disconnect between the real world and the research world. The real world is chasing the idea of happy and holding breaths for things to happen. Whereas the research world says, no, you're leaving your points on the table every day. You got to stay present. You got to slow down. You can't leave those points on the table. And so the reframe is so important for patients.
Right. You have to learn how to take the win. What can we do to sort of raise awareness? And just like you're saying, to get people to understand, and particularly high achievers, that the things that you achieve or the things that you acquire are not necessarily going to be the things that bring you joy. I'll say, bring you joy.
So I want people to first acknowledge that this happened to them, that it wasn't their fault, that this inner shame and blame that you're trying to outrun, it's a trauma response. And that's why many of us, we don't necessarily talk about our past because we're ashamed of it. And that's why I developed that system of the 5 V's, because I think it really starts with validation. When I came up with the system of the 5V methodology, I thought about 5 because I've traveled the world studying mental health, and the number 5 is a universal number. Most of us have 5 fingers, and I wanted people to envision that, joy is within my DNA when they look at their hands. I just forgot how to access it, and just to tap into one of the 5 V's every day, just to reclaim joy. And the first is really validation, acknowledging and accepting what happened to you and how you're feeling. But we tend to push down how we feel. We don't want to think about it. We just want to move on. We're like, that's for the weak. And, or maybe I wasn't taught to acknowledge my feelings, but it's so important. And the reason why it's important is because there's a term in psychology called affect labeling. So when you think about it, if you're in a dark room and you hear a loud crash and you don't know what it is because you can't see it, some of us would start swinging, some of us would start screaming, some would start running. But if you turn that light on and you saw, oh, it was just a vase, an inanimate object that fell, then just knowing what it is decreases the anxiety, the fear, and the uncertainty. And when you name your feeling and you accept and acknowledge it, that decreases the uncertainty. So when you say, oh, that's anhedonia, there's nothing wrong with me. Like, I just can't access joy right now because I'm having anhedonia. That decreases the uncertainty. So naming is the first step. Validating the experience and accepting it is the first step.
Right. And that trauma affects your behavior, whether you're aware of it or not. It's funny because I have, I'll be a little bit personal here, but, I write about this in my book because I talk about my sister, my oldest sister, Vivian, and she integrated the University of Alabama. So imagine she grew up in the Jim Crow South, so there's that. And then you have to deal with, literally wondering whether or not someone's going to shoot you on your way to school. And, dealing with what is it like to be one of the few or the only, and this is a lot of things that even today that a lot of Black people have to deal with, how isolating that is. And let me tell you, it was only after she died that the situation even occurred to me where I said, wow, that was really traumatic for her. And she never talked about it. Never talked about it in a way that, as you say, validated her experience. She could speak about it sort of, I would say as if she were describing a scene that happened to someone else, not to happen to her. She never could give voice to that true feeling of the fear of the whatever she was going through. And, and she died. She died at 63, which I now understand is quite young. And I think that is part of this thing, this trauma that is walled off somewhere, that even though you think you're coping, it's affecting not just your mental health, because you may be able to hold that together sometimes, but it affects you physically.
It does. So and please, I'm sorry about your sister.
Tell our listeners, that even when you think that you are doing well, why it's so important that you at least bring it out into the sunlight and deal with it.
Whenever you talk about your sister, it just makes me so sad. And, the fact that back then people didn't really talk, right? Culturally, you didn't validate feelings. It was seen as you complaining, right? If you were one of the few to make it out and to be a leader, you had that burden of being the first, the burden of you can't slow down, you can't let others down. So you coped by not talking about it. You pushed it down. The problem is that when you push down those feelings of pain and you don't process it, you're also pushing down and numbing the ability to access your joy. That leads me right into the second V, venting. When I bring folks into my lab, I blow up a red balloon, Dr. Malone, and I push it into a tank of water. And I ask each participant to push into the water and see what happens. And it pops up, right? That balloon will always pop up. And I use that imagery because I show them that if you don't start to express how you feel, then those emotions will pop up in ways that you can't control. It'll pop up in your health, right? That's why we have so many people going to the ER with thinking they have a heart attack, but they have a panic attack. It'll pop up in your relationships. It'll pop up in ways like soothing unhealthily by drinking too much, right? It pops up in ways that you cannot control and in ways that are damaging and disruptive. And so that's why it's so important to let that air out of that balloon slowly over time. And that could be in the form of talking to someone like a therapist. It could be talking to a faith leader. It could be talking to God, praying, writing in a journal, singing it, just getting those emotions out so that you're letting off pressure from the system. Because if you don't, those emotions and that stress will pop up in ways that may harm you and will disrupt your life.
I really want to talk about and get some of your insights into how this high functioning depression, you write about a key component being not only the inability to experience joy, but also there's a component of masochism in it. So explain that link about what is the link between high functioning depression and masochism?
In 2020, I was sitting at this very desk and I was giving a talk to this large hospital system. And this was April of 2020. I was supposed to be the voice of healing and guiding them through an uncertain time. And halfway through that talk, I was like, I think I'm depressed. And it was my first realization that I had depression. Now that I look back, I can identify clear points throughout my childhood, adulthood, where I was experiencing bouts of high functioning depression. But again, if your coping mechanism is to block it down and just push through, you don't acknowledge it. You're like, that's not me. And so I want people to understand that depression looks like two twin sisters, right? They're not identical. One is crying in bed, not functioning, and the other one gets things done, delivers, but has anhedonia and cannot access joy. And which one's going to get the attention? The one who's crying, who's not getting out of bed. But the one who is the silent one, she's going to be ignored because she's still showing up. She's still doing for others. She's still people pleasing. And what I found with folks who have high functioning depression is that they tend to not only delay and postpone their joy, they don't acknowledge it. They bend over backwards for others. They're so busy trying to show up for everyone else that they're disappointing themselves. And there was a term called masochistic personality disorder that used to be in the Bible of Psychiatry, which is the DSM-5 today, or Diagnostic Statistical Manual. But essentially, that term was taken out and abandoned because it was seen as a dirty word, meaning that it was victim blaming. So folks who would bend over backwards for others, but who would also, let's say, incite others to treat them poorly. Well, that term was politically incorrect because it sounded like victim blaming, so it was removed. But psychiatrists and therapists still use masochistic personality traits in their write-ups today. They just call it something else. So today it's known as people pleasing, right? People who can't say no, have poor boundaries, who tend to do for others, even though it's hurting themselves, who don't feel worthy of praise, who don't feel worthy of great things. People pleasing is an element. And when I did the research and I saw the caregiving as a high risk factor for anhedonia, it made sense, right? If you're someone who is a yes person, if you're someone who has low self-worth due to past unprocessed trauma, then you derive your sense of worth by your role, by doing for others. And without that role, you don't feel worthy.
So many of us are juggling so many things, work and school and family responsibilities, and be it children or be it caregiving for older parents or other people in your family. And we know that that clearly affects your mental health. But on top of that, we are now dealing with something that no other generation has had to deal with, and that's just social media and this screen time. How do you think that is affecting people's mental health?
When we're on screens all the time, that is robbing us of living in a world that is three-dimensional, that allows us to stimulate all of our senses, not just the sensory stimulation from seeing things and hearing things, but from feeling, smelling, touching, being in the world. And there was a recent study just out of one of the University of Texas universities that they took people out for 2 weeks away from their smart devices. So they still had the capacity to use their phone and stay connected, so calling and texting and so forth. But the smartphone capacity was removed. So they weren't allowed to go online and constantly be doom scrolling all day or being on social media. And what they found was that just that 2 weeks of limiting exposure was almost like an antidepressant effect in terms of the metrics they used to measure joy and happiness.
And let me just say, in my business back in the day, I'm going to sound like an old person, but I delivered babies. So I had to be accessible at all times. But there was a time before cell phones. And I can tell you this, that even having, you had a pager, the answering service would call you, you get a number, you had to call the answering service, you had to pull off the road, call the phone. I never missed a delivery. And we now think that if we don't have our phone, something horrible is going to happen in the hour that I left my phone at home. And we've got to get out of that sort of mindset. It's really it's not that deep. But before I don't want to leave without making sure that we get through those other 5 V's. So we've gone through validation, venting, and what are the other 3 V's?
Yeah, well, I think the phone issue brings us right into values, because what you were saying reminded me of how when I was a child, when we wanted to look something up, we'd have to go to the library, pull out the encyclopedia, use multiple books, use critical thinking. And now that joy of curiosity and learning is being robbed because we can just go to Google. And that information may not even be correct sometimes, right? So it's robbed us of that other critical thinking part of our ability to be human beings who are fully formed, right? So again, leaving all these points of joy on the table because the modern world is so different. But that brings us into the values. So for my clients, what I'll do is I'll take them back to a time in their past, and try to be like a little archaeologist and dig up those moments when they actually did feel that, that fullness. And we'll use things like pictures, we'll use things like timelines, but eventually we find a point where they actually became excited again. And so I give an example of a client who, he didn't remember what it was like to be, full and fed and tapped into values. So we had to go back to childhood, and he realized that before his parents got divorced, they would go camping all the time. But now he's this very important businessman in a big city, no access to nature. So we had to slowly reintroduce nature to him. It started off with getting a plant in the office, then looking at photos of nature, then taking a walk through the Central Park, and then, planning that hike. But slowly he started to connect with nature again, but he didn't remember that part because it was buried in that hidden trauma. So when you think about your values, think about things that are priceless, not things with the price tags, right? It's a nuance. So for me, learning because curiosity made me feel so accomplished internally versus being extrinsically motivated by the good grades or the fear of failure.
Now, the first step to all of this is really recognizing that high functioning depression exists. And people have to realize that it exists so they know that there is help and there is a solution for it. But sometimes people are a little resistant to coming to that. So what would you suggest for friends or family members if you see that someone around you, a loved one, or is experiencing what you think is high functioning depression because they've read your book and now they know all about it? What would you suggest that they do? How would you talk to someone that you love or someone that you care about, and you see, wow, this sounds very familiar to me? What advice would you give them?
Well, you can't control others, but what you can do is you can control yourself. And I know it's not a satisfying response for many people, but the reality is that you can't change people. But what you can do is you can model the behaviors that you wish to see. So knowing that there's someone in your life who is accustomed to giving. Maybe they have low self-worth, unprocessed trauma. They just don't feel worthy enough to slow down. You may have to start saying, you know what? It's okay. You don't have to do this for me. You may have to show them that, listen, I'm here for you, even if you don't do anything. You're giving them permission to sit still. And they may look at you like, well, why? But just say, listen, I'm just here for you. I just want you to be able to rest. And I want you to be able to enjoy your life. You don't have to show up all the time. You also may have to meet their basic needs. Many of my clients with high functioning depression, they are not meeting their basic needs. Always take care of yourself first, because it is not easy being around someone who can't slow down. It is contagious, but you may have to model the behaviors that you wish to see in that individual.
Dr. Judith, before we leave, I want to make sure that we get to those other 3 V's in the 5 V's for high functioning depression. Can you go over those quickly for me?
Yeah. So we talked about tapping into the values, and, the basic needs brings us right into vitals. Many times they're not taking care of their basic needs. So vitals are, focusing on getting good sleep, letting them rest, eating foods that are not processed, foods that are healthy for your brain, getting good movement. Vitals are also modern vitals, like a healthy relationship with technology, not being exposed to too much of that, a work-life balance, and the relationships that you're in. Relationships are the number one predictor of your longevity. So these are all the vital signs I asked you to really pay attention to. And the last V is vision. How do you celebrate your wins? How do you plan joy in the future? Many of these folks, it's always on to the next, right? That single mom or that working parent, it's always on to the next. You get the kids to school, on to work, get the homework done, on to the next task. Help them to celebrate their wins. Slow down.
Well, that is fantastic. And that now they know how to name it. And after reading your book, High Functioning, they will know what to do about it. But before we close out, I want you to give me, what are your 3 main points that you would like for our audience to walk away with today?
Well, first of all, thank yourself for listening, because you didn't have to listen, but you were curious about the science of your happiness. So that act alone is an act of love and self-care towards yourself. And I want you to start thinking about the science of your happiness. There's only one you, and there will only ever be one you. So rather than just using tools that work for others, first understand what makes you so special and unique, and understand and validate your past experiences. And then apply these tools so that you can start to reclaim those points of joy that you lost along the way. So I want you to understand the science of your happiness, and I want you to tap into 1 or 2 of the 5 V's daily. Don't do all 5 at once. Don't be high functioning.
I want to get an A on the 5 V's.
And then slowly start to notice how people start to look at you. They're going to start saying, like, there's something about you that's different. I want some of that too, because that joy is going to be contagious. In the way that anhedonia spreads, joy has the capacity to spread and to heal not just yourself, but those around you.
It's time for the last part of the show, and this is where I give my doctor's orders, and I leave our audience with takeaways from today's conversation. And number 1 is high functioning depression is real, even though there's no official diagnosis for it. Now we know because Dr. Judith Joseph has done the research and named it for us. Secondly, I want to say there are no trauma Olympics. And don't compare your trauma to other people's trauma. Another important point that I want to leave our audience with is that fatigue and just overall malaise, not feeling well, not feeling like yourself can also be signs of physical illness. So please don't forget to get your checkups and screening and make sure that there are not other physical things that can be contributing to this lack of joy and depression that you may be feeling. A big thanks to Dr. Judith for dropping some serious knowledge here today. Keep joining in each week on YouTube or wherever you find your podcasts as I break down complex medical issues and give you actionable advice on how and when to secure that second opinion. If you enjoyed the show, make sure to follow us so you never miss an episode. And if you have a moment, leave a review. Until next time, take care.